Welcome to the Common Mental Illnesses Crash Course, your gateway to understanding and conquering the challenges that millions face daily. Let's begin. Number 1. Depression. Depression is not just about feeling sad or down from time to time. It's a serious mood disorder that affects a person's thoughts, feelings, and daily functioning. It's characterized by persistent feelings of sadness, hopelessness, and a loss of interest or pleasure in activities that were once enjoyable. It can also manifest physically, leading to changes in appetite, sleep disturbances, and fatigue. It's essential to understand depression comprehensively in such a course to provide valuable insights to individuals struggling with their mental health. Depression is often linked to imbalances in neurotransmitters, like serotonin in the brain. These chemicals regulate mood, and an imbalance can lead to symptoms of depression. Mental Illnesses Crash Course helps individuals understand that depression is a real, treatable illness, reducing the stigma often associated with it. It also educates people about the signs and symptoms, enabling early detection and intervention. Number 2. Anxiety disorders. Anxiety disorders are a group of common mental health conditions characterized by excessive and often irrational worry, fear, and nervousness. These disorders can significantly impact a person's daily life, relationships, and overall well-being. A crash course on anxiety disorders provides comprehensive information about various anxiety-related conditions such as generalized anxiety disorder, social anxiety disorder, panic disorder, and specific phobias. It explains the causes, symptoms, and risk factors, helping you recognize and understand your own anxiety. Education about anxiety disorders can help reduce the stigma associated with mental health issues, encouraging more open and empathetic conversations. The course teaches you to identify triggers that exacerbate your anxiety, allowing you to make informed decisions to minimize these triggers in your life. Common mental illness. Crash courses often include practical coping strategies and techniques, such as relaxation exercises, mindfulness, and cognitive behavioral therapy, CBT. Recognizing anxiety disorders early through education can lead to early intervention and treatment, which is essential for preventing the conditions from becoming more severe. By addressing anxiety disorders, individuals can experience an improved quality of life. They may find it easier to manage their stress, maintain healthy relationships, and pursue their life goals. Number 3. Bipolar disorder. Bipolar disorder, previously known as manic depression, is a complex mental health condition characterized by extreme mood swings that include periods of mania and depression. During manic episodes, individuals with bipolar disorder experience heightened energy levels, impulsivity, and an elevated mood. They might have racing thoughts, reduced need for sleep, and exhibit an exaggerated sense of self-importance which can be disruptive and even destructive. In contrast, depressive episodes in bipolar disorder are characterized by low energy, sadness, hopelessness, and a lack of interest in previously enjoyed activities. Individuals may experience changes in appetite, sleep disturbances, and thoughts of self-harm or suicide. Recognizing the signs and symptoms of bipolar disorder early can lead to prompt diagnosis and appropriate treatment. This, in turn, can prevent the disorder from worsening and improve the quality of life for affected individuals. A crash course on bipolar disorder can equip you and your loved ones with strategies for managing the condition, from medication management to lifestyle adjustments and coping techniques. Armed with knowledge, you can advocate for yourself in healthcare settings, ensuring you receive appropriate treatment and support. If you are enjoying this video, don't forget to hit the subscribe button and turn on notifications for this channel. Let's continue. Number 4. Eating disorders. Eating disorder are complex mental health conditions that involve unhealthy relationships with food, body image, and often result in severe physical and emotional distress. They are relatively common mental illnesses and can be a crucial part of a common mental illness crash course due to their prevalence and impact on individuals. There are several types of eating disorders. An example is anorexia nervosa. This is characterized by an intense fear of gaining weight and a distorted body image, leading to self-imposed starvation, extreme dieting, and excessive exercise. This disorder can have serious physical and psychological consequences, making it imperative to include them in a common mental illness crash course. The course typically provides information about available resources, including therapy options, support groups, and professionals who specialize in treating eating disorders. Number 5. Obsessive-compulsive disorder, OCD. Obsessive-compulsive disorder, OCD, is a mental health condition that falls under the umbrella of anxiety disorders. It is characterized by the presence of obsessions and compulsions, which are intrusive and distressing thoughts, obsessions, and repetitive behaviors or mental acts, compulsions. These obsessions and compulsions often cause significant distress and interfere with a person's daily life. The course teaches participants to recognize the signs and symptoms of OCD, enabling early intervention. Understanding the disorder is the first step towards seeking help and support. It can be an isolating condition, as individuals may feel ashamed or embarrassed about their obsessions and compulsions. But the crash course fosters a sense of community and support, reminding individuals that they are not alone in their struggles. Number 6. Post-traumatic stress disorder, PTSD. Post-traumatic stress disorder, PTSD, is a complex and often debilitating mental health condition that can develop in individuals who have experienced or witnessed a traumatic event. These traumatic events may include combat, natural disasters, accidents, physical or sexual assault, or other life-threatening situations. PTSD can affect anyone, regardless of age, gender, or background. Individuals with this condition may experience recurrent, distressing memories, nightmares, or flashbacks related to the traumatic event they've had in the past, thereby making them avoid places, people, or activities that remind them of the trauma, feel emotionally numb, and have difficulty expressing their feelings. If you found this video helpful, make sure to like this video right now, subscribe to this channel, and hit that bell button for more tips on mental health. Check the link below for the playlist on these topics. There are more information you would not want to miss. Thanks for watching, and see you in the next video.